Hello and good afternoon, everyone. I am delighted that you're joining us potentially during your lunch break for this hopefully informative webinar. The webinar today is dedicated to a specific topic, the European Council conclusions. And together with my fellow panelists, we will hope to answer some questions regarding how to leverage the EU Council conclusions on cardiovascular health. This session is brought to you by the European community, the European Alliance for Cardiovascular Health, and as FH Europe Foundation, we are delighted to support this event. So, my name is Magdalena D'accord. I'm Chief Executive Officer of FH Europe Foundation, and as mentioned earlier, I will be the moderator for today. The goal of this webinar is simple, is to help you understand what the Council conclusions are, why they matter, and how you, whether as an individual or an organization, can leverage them and can take action in your own context, in your own specific country. And I think it's extremely important to emphasize that those are EU Council conclusions and most relevant when it comes to action for people based in the European Union member states. However, if you're joining us from outside of the EU, it might be an interesting idea for policy actions in specific regions or countries you represent. But we will come to that in a second when we ask you where you're joining us from. So, we will hear today from three excellent speakers who represent the policy, scientific, and patient advocacy landscapes. And don't worry, the good thing is that we are making it easy for you, so you don't have to be a policy expert to actually make a difference. Before I start the introductions, I just wanted to share with everyone that due to unforeseen circumstances, one of our speakers could not join in person, but we have a special message recorded by her for us, and that is Mrs. Kitty Almer, Public Health Attaché from the Permanent Representation of Hungary to the EU, and she herself was the chair of the Council Conclusions Group. So no better person who could really help us decipher what Council conclusions are. And from the European Alliance for Cardiovascular Health side, I am being joined by Mrs. Sophie Miller. She's the EU Policy and Advocacy Manager and working at the European Society of Cardiology, and representing the patient perspective, a fellow advocate is Ms. Joanna Tenkate, Policy and Advocacy Manager from Global Heart Hub. Without that, I think it's back to you guys. We would love to understand where you're joining us from, whether you are affiliated with the European Alliance for Cardiovascular Health, and a few other questions that we have prepared for you through a Mentimeter. So if you're using Mentimeter for the first time, you are seeing now on the screen a QR code, or you can just go directly to a website called menti.com, and there you can enter the code 8773 6207. We have three questions for you, so help us understand where you're joining us from today. So it's great to see that we have colleagues joining from Germany, the Netherlands, Switzerland, Belgium, UK. Great. Probably it's worth mentioning that we had 128 people registering for this webinar, and we can see that there is over 50 people already present. We have Hungary, Austria. It's interesting to see those local differences. We have people from Scotland and Bavaria. I think it's relevant because you actually have local governments, and some of the actions might take on the local level. Great, Portugal, fantastic. So there's quite a lot of people joining us from the EU member state countries. Wonderful. With that, I would like to invite you to go to the next question. And the next question is, if you are affiliated with any of the EACH partners, and I can appreciate that you haven't heard about EACH just yet. Sophie will help us understand what the European Alliance for Cardiovascular Health is. But I would assume that if you are affiliated with any of those organizations, you would know that. So if yes, if you can just pop in the name of the organization, it would help us understand. So we have MedTech Europe, we have Aortic Association, we have, I guess, ESC, FH Europe, Amgen, which would be under the FPIA umbrella. Some of you are not affiliated, which is absolutely fine. Okay, Bach, which is the Belgium equivalent of the alliance. Great. So we have a interesting pool of different people coming from different backgrounds, which probably will help this discussion be a little bit more dynamic. And we will definitely invite you to pop any comments and questions in the chat. We also have colleagues, I can just see now, colleagues joining us from Zambia as well as Jakarta. Well, that is definitely a great mix of people. Without any further ado, I will just invite my colleagues to go to the next question. And the next question and the last one is how familiar you are with the Council conclusions. If you're very familiar, what are you doing on this webinar? I hope you will share with us some amazing examples how you've leveraged them. And if you are just quite familiar or not very familiar, I think this is the place to be because we will help you understand it even better. Okay, so for now we have 17, 20 people out of 34, so just over half of you. And it's between slightly and moderate familiar. Great. Well, I hope this session, this lunch hour will help answer any of the questions that you might have. Thank you so much. And before I hand over the floor to Sophie, I just wanted to take the opportunity to mention a little bit about FH Europe Foundation. We are a network of patient organizations active in familial hyperlipidemias. Those are genetic lipid disorders and mostly CVD risk factors. Under our umbrella, we have over 30 patient organizations from around Europe and with Global Heart Hub and members from Asia, Africa and Middle East. We are saying that we are a little bit bigger and wider than just Europe. And I am delighted that we are as well a partner of the European Alliance for Cardiovascular Health, advancing the cardiovascular health mission here in Europe, but also outside. And with that, I would like to invite Sophie Miller to take over the floor and help us understand what each is. Sophie, the floor is yours.
Thank you, Magda, and good afternoon, everybody. Thanks for joining. It's great to see 60 plus people connecting over lunch break. So really hope you will enjoy this session with us. As Magda introduced, I'm Sophie Miller. I'm EU Policy and Advocacy Officer at the European Society of Cardiology, ESC for short, who also has the great pleasure of having the current secretariat for each, the European Alliance for Cardiovascular Health, each for short. And I just have a couple slides I'll bring up now, which just to set the scene a bit and also take the chance to introduce each. So before getting into each as a group, just some context on why each also was created. And some of these stats maybe you are very familiar with, but I think we're often surprised in the work that we do of the general level of understanding and appreciation of the burden of cardiovascular disease in Europe, that many people still are actually quite unaware. And our headline is that cardiovascular disease is currently the EU's biggest killer, the #1 killer, approximately 5,000 CVD deaths per day. It's almost 1 in every 3 deaths, cause of death. So this is absolutely huge and gives us the rationale of joining forces. And we don't like this stat. Okay, it can grab the attention when we go and meet policymakers, but we don't like this stat. We do not want this stat to continue to exist. We do not want CVD to remain the EU's biggest killer, which is why we're grateful that you also joined today to see how we can tackle this together. Nearly 5 million new cases of CVD are diagnosed annually, and this leads to over 62 million people living with CVD, and these stats are for the EU only, so imagine globally. And also globally, CVD is still the biggest killer worldwide, not only in the EU. And not only that, but we also see a disparity when it comes to geography and gender. So CVD is the #1 killer of women, as you can see on the right in the figure. And this is something that we also, of course, want to change. And CVD perceptually has been seen as maybe a men's disease. If you've seen public awareness campaigns in the past, you would always see a man clutching their chest, but we're really trying to change that as well. And that, symptoms are also different in women. Sadly, also in women, they have a 20% higher mortality after a heart attack compared to men. So disparities in diagnosis, in care and rehabilitation. So there's plenty of work still be done. And in terms of geography, we also see differences within countries and also across the world and across the EU. Just to give an example, women in Bulgaria, the percentage is 65% of deaths are caused by CVD, which is absolutely striking compared with Denmark, where this figure for women is 20%. So we have a lot to do at the EU level. Also within countries, within regions, there can also be differences. And not only how it affects us as population, also budget, which is also something to grab the attention of policymakers. They really, as well as knowing the personal story and that side, numbers speak volume as well when it comes to budget. So the CVD costs the EU 282 billion every year. And this is somewhere around 20% of all healthcare expenditure in the EU is being spent on CVDs. This is also a huge rationale and push for, spending on prevention rather than spending on treating the disease. So that's just some of the stats that also come from our ESC Atlas data. And we have some stats per country as well. I can put the link so you can get your country data in the chat after. And this is really brings us to why was each created, which was done so in 2021 by gathering different partners. As you can see, I'm sure you'll recognize some of the logos on the screen, but we have medical societies, we've got amazing patient representatives, we also have industry there and other allied health professional groups and research groups. And it's really this collective effort that is behind the drive of each. And in 2022, we put out our first call for a cardiovascular health plan, that we need a united, collaborative, collective health policy approach to the CVD burden and the CVD question. So this is us, some screenshots of meetings in the last year, different workshops. There's a nice picture of us also meeting the Commissioner for Health, Mr. Oliver Varhelyi, earlier this year. And so really for the last 4 years or so, as mentioned, we've been calling very strongly for the call for our EU Cardiovascular Health Plan, for national cardiovascular health plans. And here's just some nice snippets of some of the activities we've done. We had a poster campaign. You can see we had posters in the metro stops and bus stations, the key ones in Brussels. We had numerous events, both in Brussels Parliament, in Strasbourg Parliament, and beyond. So we've been busy, and it has had positive effects, I believe. Now that we expect the EU Cardiovascular Health Plan to come before the end of the year, we can get more into that later. But just wanted to highlight our latest, biggest achievement, let's say, of the year so far, which is the launch of an MEP cardiovascular health group inside the European Parliament. This group is an informal interest group of MEPs who are strong advocates within the Parliament to work on improving cardiovascular health for the populations and for their citizens and for their voters. And here we launched the group in April. And we have currently 16 members, and the chair of the group is MEP Romana Jerkovic from Croatia. And we also have other countries present, Lithuania, Hungary, Ireland, and so forth. And this, you can find more details on our each website as well. I will leave the link in the chat. So this is a bit of an intro to who we are. And maybe I didn't discuss it beforehand with my colleagues, but I think we can give a very quick the first information that we will have a cardiovascular health summit towards the end of this year, 10 and 11 of December. We're still planning within the each program committee, but it will be held in Brussels. So hope to see many of you also join us there.
Thank you so much, Sophie. And I think it was very, very helpful. I can see that it sparked a lot of interest in the chat, people asking about those slides. I guess it's very nicely put when it comes to all the data in one piece. It's staggering to see the impact of cardiovascular disease across Europe. And you've mentioned in your intervention the ESC Atlas, which is a great source of information. And I've asked our team to pop it in the chat. You will receive a link in the next few minutes. And if not, we will disseminate it in the after the event in the special email address. So don't worry about it. You've also mentioned the summit, and I think it's extremely helpful for people who are joining us today to understand that there is the work is just beginning, although it's been already undergoing for so many years. I remember the humble beginnings back in 2020, and it's important for everyone on the call to understand how long it takes when it comes to advocacy and influencing policy and talking to different stakeholders. So I think it's great to as well see that so many of the MEPs are part of the each as a cardiovascular health group, because if you are representing a specific country, you might leverage that opportunity that your MEP from your country is as well on this pan-European group. There is another document that we also as each have produced. So along the European Cardiovascular Health Plan, the need and the ambition back from 2022, if I recall well, or 2023 now.
Yeah.
There is the last one from this year. So again, the team will be sharing it so everyone can read it for sure. But now, back to the famous council conclusions and what makes them so special for our community. And as mentioned in the opening, no better person to walk us through the council conclusions than Mrs. Almer, who chaired the group on council conclusions. So even though Kitty is not joining us exceptionally in person today, we have her recording from the first webinar that took place 2 weeks ago. So without further ado, I shall say, Kitty, the floor is yours, and let's load up her presentation.
Thank you very much, Magda, and also welcome everyone this afternoon, and thank you for joining this webinar. I am honored to be invited into this panel, and I am very happy that this set of council conclusions will not remain one in the drawers, but we can actually talk about it and leverage it. What I can say as an introduction to my council conclusion presentation is that everything that Aoife was explaining beforehand, how much of a burden it actually means on patients, communities, and on actual governments, cardiovascular diseases, is that we heard it. During the Hungarian presidency, we heard these problems and we wanted to solve it. As far as I'm actually educated, there hasn't been another council conclusion very specifically on cardiovascular health in the last 20 years. So what we say is that we wanted to be pioneers in this. It was a very intense set of negotiations what we had to go through, but I'm very, very happy of the end results that we've got. And allow me to share my screen and walk you through my presentation in explaining how council conclusions work, and I hope that everyone can see it right now. The council conclusions is actually titled as Council Conclusions in the Improvement on Cardiovascular Health in the European Union. This is how you can also find it. It is a publicly available document. I do see it as a comprehensive opportunity right now for also policymakers, but also patient representations and civil society to use these council conclusions to let it actually be a useful document for once. Let's get into the basics. What are council conclusions in general? This is not something that, as far as I remember, is actually educated in universities, but if it was, it is something that I actually learned how it is built up during this presidency time. The Council conclusions is an official political statement which is adopted by consensus all EU member states. That means that all of the countries that were accepting this document accepted every word of it. They actually made a commitment in implementing it. It is reflecting a shared political commitment, but it is important to highlight that it is not a binding law. This is not something that can be sanctions if a country or the European Commission decides not to implement what is included in the papers, but it is more of a political pressure that can be used here. It is also setting directions for future policies and programs and finding and cooperation. It's basically a map. And it also offers the civil society organizations a very solid point of reference for how to engage, how to advocate for it, and what kind of partnerships and how can these partnerships can be further built. I will get into that a little bit more detail later. Why are these council conclusions are actually important right now? Why are we here? These council conclusions raise a political profile of cardiovascular diseases across the European Union. It actually brought it up to the highest of attention during our presidency. These established the common priorities in prevention, care, rehabilitation, innovation, secondary prevention. Everything what this was needed here was included in the council conclusions. I want to highlight that this was actually not just written by me. It was not written by our government. It was written together with the civil society. ESC was a fantastic help in pointing out what is actually missing, what should be done, and where should we put the highlighting points, what should be done better for now. So this is a common result. The conclusions can also influence the EU funding programs, such as the EU for Health or Horizon Europe. But right now, of course, that is in the hands of the financial ministers, how they are going to go about it next year. They also provide a shared language, because it is very important to use and acknowledge this shared language that is included in the conclusions, because this is that can be used when dialoguing and talking with governments, health authorities, or other funders, because it was not an easy task to agree on each and every word in the conclusions, but every member state and the Commission also agreed to it. When it comes to health, there has to be a little bit of clearing up how it actually works. I know most of you are, of course, very much aware how it works from a legal point of view, but it is always better to repeat it. The legal competence of health remains in the hands of the member states. According to Article 168 of the Treaty of the Functioning of the European Union, the EU supports and complements these national actions, but does not replace it, and it is still a member state responsibility to provide these health services. It also ensures the health protection across all policies. It's a kind of small One Health. What is the practical meaning of this? The EU can drive strategies and frameworks and cooperations and funding, but what remains essential here is the national implementation. So your point of view and your point of contact is, first of all, always the government of your national point. The civil society can therefore engage both at EU level, meaning the Commission, or the national levels to promote a full use of these conclusions recommendations. Let's focus on the conclusion itself. During the Hungarian presidency, we wanted to create a document that is going to be impactful, that is going to make a change, even if it's not a legal document, even if it's just policy making. We aimed for a full life approach in cardiovascular health. That means promotion, prevention, where we wanted to encourage healthier environments and behaviors, all is very much in detail listed in the document. Screening and early detection, very important as well, to identify the risks and diseases early. When it's too late and treatment is needed, we need to ensure that effective and timely care is provided to those at risk or even already being a patient. Rehabilitation and secondary prevention, which is so often forgotten, unfortunately, to support full recovery of the patients and also preventing the reoccurrence of these cardiovascular events. And innovation, of course, we could never have a council conclusion without highlighting the importance of innovation. That means integrating AI, whether we like it or not. AI is taking over most of our technical tools, telemedicine, and personalized care to improve health outcomes. We wanted to put a strong emphasis on equity. That means that we wanted to leave no community, age group, or patient behind. All access needs to be provided in all of the member states without difference being given. Someone is in Belgium or in Romania, or the western side of the country or the eastern side of the country. It's a dream, but we are working towards it. What were the key challenges that we highlighted in these conclusions? There are more of them naturally, but I wanted to highlight a few of them that I felt were very important. That we acknowledged and considered that there is persistent inequalities between and within member states. As I have already said, there is unequal access. Gender disparities, that was already highlighted by Aoife. Women are often underdiagnosed and undertreated. We still consider cardiovascular health as a men's disease. That this kind of thinking needs to be changed, and better understanding of the effects of women needs to be educated. The environmental risk factors were also taken into account. Pollution, noise, climate change, those are all impacting cardiovascular health, whether we experience it right now or not. The behavioral risk factors or modifiable risk factors were also included: unhealthy diet, tobacco use, or physical inactivity, and harmful alcohols. The list goes on. And what is more so very important is the economic burden of it all. The cardiovascular diseases are costing not only for treatment, but also the loss of productivity, and countries are paying the price for that at the moment. Let's get back into the conclusion itself for the document. There are a few parts on how to read such a document. There is the first part, introduction, welcoming, recalling, that is listing the previous EU and WHO initiatives, what was done, what should be highlighted, what to take into account, so that we don't repeat ourselves. If something was done, fine, then we need to make it better or start new initiatives. There is a part which is the considerations. The considerations are actually the longest part right now in the conclusions, I think at least half of it, because there are so many things to consider. The scale of the CVD burden, the health systems gap, the gender disparities, the social and environmental determinants, and so on. And then the last few pages of the document is basically the invitations. There is recommendations and invitations to the European Commission and also to the member states. Usually there is a part in other council conclusions that is listing for both, but in this example, during the negotiations, we recognize that it is as unnecessary and the tasks division was clear. So let me get into the considerations and why are they actually so important and why are they the longest part of the document. These are actually the points where the problems are officially recognized by all member states. The inequalities in prevention, the lack of consistency in early diagnosis, the need for comprehensive rehabilitation services, just to say a few examples. So the civil society side can reference these considerations because these are, as I said, agreed language. These can be used for raising public awareness, not necessarily about the council conclusions, but I'm very happy if the public also knows about it, but just about the problem, just about what was invited to the Commission, what is there for the member states. Also very useful for dialoguing for policymakers. Policymakers know exactly how to communicate about this, and they know the shared language of this they are supposed to. And also very important for applying for project support. Usually, in this document, the invitation to the member states is listed first, but I wanted to come first to the European Commission part. And why? The point that made or break these council conclusions was the European Cardiovascular Health Action Plan. We had a very difficult situation when we were negotiating this. There was the elections of the European Parliament, which meant also a new commission is going to be set. Nobody knew who is going to be the new health commissioner. And also, because of this, when we were negotiating the conclusions, the Commission was also in a very difficult situation because how could they commit to a cardiovascular health action plan because when they don't know who is going to be the new commissioner, what is going to be the direction of this commissioner? Well, the stars aligned, thankfully. And during the Hungarian presidency, the Hungarian commissioner was chosen to be the health commissioner, Oliver Várhelyi, and he took it upon himself already on the 3rd of December in 2024, even before the adoption was actually done. The member states haven't voted for the council conclusions officially. Oliver Várhelyi commissioner has already endorsed the council conclusions and the European Cardiovascular Health Action Plan. This was a milestone. This was the moment that made our council conclusions actually matter. This is also a point of reference for the civil society. We also asked the Commission to promote and collect the best practices across the European Union on prevention, treatment, rehabilitation, and screening. Also in enhancing data collection and registry separately for cardiovascular health, also in connection with the European health data space. And also to support research and innovation such as personalized medicine, AI-based diagnostics, or telehealthcare services. And now come the member states. For the member states, what we invited them to do is to develop or update their cardiovascular health strategies. There are member states who do have a cardiovascular strategy and member states who do not. They can choose whichever they would like to do. Expanding early detection programs, for example, regular cardiovascular screenings into the public health programs, promoting health literacy and public awareness, which cannot be highlighted enough. strengthening secondary prevention and rehabilitation services, which is lacking behind sometimes and easily forgotten, addressing socioeconomic inequalities in health outcomes, which is a holistic question, of course, because that matters to all, not only cardiovascular health, but all health questions, reducing environmental factors affecting cardiovascular health, and facilitate the use of innovation, which cannot be highlighted enough either. For the civic society, it is also an opportunity to engage on these questions with national health ministries and agencies. Ask them what is their plan in implementing these questions. They might not know that because, of course, we only accepted it half a year ago. It's only the end of the Polish presidency, but it does help to keep them in the loop that this is still existing. Encourage the development of funding of national strategies, because that is going to be always a question for them. Are they going to have enough money for that? Are they going to make it a priority? If they receive the pressure, they may think about it differently, but then again, it's also in the hands of the member states. And to also, and the most important part is to offer the patient perspective and also your expertise. That is a knowledge that is unfortunately not always available to national governments. So, how can the civil society use the conclusions? I have already given you a couple of hints, but just to give you a list as well, to reference these conclusions in national advocacy and dialogue, because again, this is on the table of every health minister, or at least in the drawer. To encourage the governments to act on the agreed invitations, because they all accepted it. To contribute shaping the EU-level initiatives, such as the European Cardiovascular Health Plan. I do not have official information when the first draft, the European Cardiovascular Health Plan, is going to come out, but now is the time to ask for a seat at the table that is going to decide how it is going to look like. We gave a map, and now it's up to the Commission and for you on how it is going to be implemented. And to collaborate across borders, to share best practices and strengthen patient voice, because the community itself is going to be the most important part in this. So just to give my final takeaways, I do believe and I hope with all my heart, pun intended, the 2024 conclusions mark a turning point for cardiovascular health in the EU. And how we wanted to build it up is to offer a strong and united political commitment from all the EU member states, but the implementation remains key. The civil society organizations do have an opportunity to ensure that no community is left behind. You know it better than we do in the fight against cardiovascular diseases. And by working together, and this is my final message, I hope that we can turn this political promise into healthier lives for millions of people in the European Union. Thank you very much.
Thank you so much, Kitty. It's been amazing. I'm listening to this presentation for the second time, and I've realized that there's still a lot that I'm learning. But I'm so delighted that your presentation has sparked a lot of questions as they are popping in the chat. And I would like to reserve those for the latter part of our session when we will try to answer them. One comment, however, as Kitty has explained, this is a roadmap and this is a political document. This is not a medical guideline, and this is not intended to suggest how to run a specific protocol on a specific condition. I've seen a lot of questions in the chat, and I think we need to be able to distinguish. This is a policy document. This said, a link directly to the council conclusions was already posted in the chat. Just as a reminder, the council conclusions were published on the 3rd of December 2024, and it's a document of 26 pages. There's a lot more that you can find in the document, and I can see that we are being joined by colleagues and friends from the stroke organization, as well as some advocates living with rare conditions. There is a lot you can find and leverage, whether it is rare CVDs, stroke. I can see as well colleagues from kidney community. There's as well reference to cardiometabolic kidney conditions and so on and so forth. So there is definitely a lot for everyone. But today specifically, we want to focus on cardiovascular disease and our community as such. And so now I think it's extremely important to demonstrate how the council conclusions are being used in practical terms. And again, some of you were asking, what happens next? What can I do? What can my organization do? And I'm delighted to be joined by Joanna Denkate from Global Heart Hub, as well, partner of the European Alliance for Cardiovascular Health, and a great community, advocacy community. So Joanna, take us away and show what the patients community can do.
Thank you so much, Magda. I'm just going to go ahead and share my screen, if you can see that all right.
All good.
Wonderful. So thank you, Magda. It's so wonderful to be here. I want to first thank FH Europe and EACH for having me on this webinar. My name is Joanna. I work with Global Heart Hub, and I'm really excited to talk about some of the things that's happening across the EU. You've already heard about the urgency of the issue and the impact this could all have on cardiovascular health. So what I want to focus on is how advocates can respond to these opportunities, especially from the perspective of the cardiovascular patient community in the EU. So just quickly, for anyone who may not know, Global Heart Hub is an alliance of cardiovascular disease patient organizations and advocates around the world. We have a wonderfully strong network in Europe with over 65 patient organizations across the EU, all dedicated to centering the patient experience and using it to affect change. I'm also delighted to see a few of our affiliates on this call today, so hello to you all. And so our goal in bringing these patient organizations together is to have a united voice. So that means supporting their local work while also helping to amplify the patient voice on a regional level. And this is an excellent example of how that can be done. So we do this by staying very closely connected with our patient community, listening to them, learning from them, and by providing advocacy and engagement support and opportunities that can help all of our affiliates strengthen their work, but really bringing us all together to have their voices heard on things like this. So as previously covered, the EU Council conclusions are at a really pivotal moment. There is a plan coming together for cardiovascular health, which is such a huge, momentous step forward. There's a lot of excitement behind it because it's, I'd say, long overdue. But it's not enough for a plan to just exist. If it sits there on a piece of paper, that's all well and good, but we need real investment behind it. You need the money to actually have these things rolled out in member states. And that investment won't just matter at the EU level. It will ripple out and affect every individual member state, and it will give heart disease the urgency and the focus it needs and come down to real programs and real initiatives to people's local communities. So one of the key calls to action right now is for advocates to contact their national ministers of finance. And this is because discussions around the next round of EU funding is starting very soon, and these ministers are in a position to support EU-level investment in cardiovascular health. And that investment would mean better care, awareness, and access for people in every country across the EU. And these ministers of finance need to hear from the people in their country about why this is important. As I'm sure everyone can understand, there's a lot of competing interests right now, a lot of different places that money can go. And for them to put it into cardiovascular health, it's going to be because they believe it's important, it's going to make a difference, and that people are demanding it. So I really can't emphasize enough how important of a call to action this is. So done right, this will translate into significant funding for cardiovascular health that will ripple out across the EU. And this kind of funding will hopefully set us on a new path toward better, more responsive, and more proactive care, which of course means lives saved. Action and funding at the EU level will also motivate similar action at the national level. And this kind of pressure can push national policymakers to have national cardiovascular health strategies and their own dedicated funding, so thus opening up another opportunity for progress and for the patient voice and all advocates to engage. And of course, we want and need as many voices across the EU as possible. Everyone from patient advocates, the clinical community, the public, anyone and everyone who can call upon policymakers to take action. So for my role in Global Heart Hub, my focus naturally has been on the patient community, and I am very excited for this opportunity for patient voices to be heard and to be part of the process, because it does pose a chance for us to be engaged and recognized as equal stakeholders. So we don't want to let this opening pass us by as the patient community, but really it should be everybody involved. So again, just to highlight how much we need as much action as possible, because right now what we do will determine the outcome. So everyone has a hand in improving cardiovascular care, early detection, and outcomes. So if this seems like a small thing, sending a letter, I'd really encourage you to take a different look at it because it is actually an important step forward. I also want to recognize here that advocacy can sometimes feel overwhelming. You might look at this and say, where do I start? Am I really in the position to advocate for something like this? Do I have the right background, the right training, the right access? But really, that's not what being an advocate means. You don't need to know all the ins and outs of EU policy. To be honest, nobody really does. I don't know everything, really nobody can. What matters is to use your voice to speak up about what you do know is important, because honestly, your voice matters, especially if you're coming from a national or local community, because makers care most about what their own constituents think, because they are most accountable to you, so there's no one better suited to speak up and ask for what's needed. We have already seen patient organizations and advocates from the Global Heart Hub community step up to answer this call, especially over the last week or so. We're seeing a lot of people reach out to their finance ministers in all kinds of countries across Europe. And I know FH Europe has similarly activated their wonderful community, and it's been great to see how the patient community has been stepping up. And I hope this will serve as an example of what's possible for all advocates, because again, we need as many voices as possible to show just how broad and how urgent the support for cardiovascular investment really is. As a member of each, like all of our partners, Global Heart Hub is committed to making sure our community has the support they need to take action. This means we want to provide guidance and tools, but of course that we are also here to answer questions, provide encouragement, and support and advise whenever possible. So we've been activating resources for our community, but this help, again, is available for all interested advocates through EACH. So the European Society of Cardiology and the EACH Alliance have done amazing work creating templates for ministers of finance that you can then adapt for your own country. And we've also put together a list of relevant ministers of finance across the EU, along with their contact details. So hopefully these first steps are easy to follow and easy to activate. And Global Heart Hub, at least as a part of EACH, is here to support our community and the rest of the EACH community however we can, whether that's answering questions, amplifying your advocacy through social media, whatever it may be. We know every message and every conversation adds up and it makes a difference. So I just want to thank FH Europe and EACH again for having me here. And thanks everyone on the webinar for being here and caring about this topic. If you would like to reach out to me, you're very welcome. Otherwise, thanks again, and I'll hand it back to Magda now.
Thank you so much, Joanna. That's brilliant. And that was so practical. I think people here were posting, then the number of very specific questions has been incredible, and you've answered a number of them with your presentation, so thank you for that. And just as a reminder, Sophie and EACH as the Secretariat have prepared those templates. You guys from Global Heart Hub have put together the list of ministers of finance. Respective partners of the EACH Alliance have been sending emails. Just to top up the examples that you've mentioned from FH Europe Foundation, we sent an email to all our community, not only patient organizations, but everyone on our list. And we know that actually a group of clinicians in Italy issued a letter to the Italian Minister of Finance. And if anyone else has done that, please share, because then collectively we put the list under the umbrella of EACH and we have a better understanding. We can map it out and follow up on that. And just very quickly, I've seen some questions because we are addressing an international community. Some of the people don't necessarily live in a specific, in a country where they come from. I think it's relevant to remind ourselves this is tailored, this particular action is tailored at the European Union. And so if you come from, let's say, Ireland and live in Switzerland, you would be addressing the Irish Minister of Finance for many different reasons, but one of them would be the fact that Switzerland is not part of EU. And you already know now Global Heart Hub and CRE in Ireland who can support you with that, not picking up on anyone specific in our audience. Yes. So what happens next is, as a follow-up to this webinar, we are sending once again this communication, and you will receive a link to the template letter. And Sophie, you were mentioning you had an anecdote how to use those templates. Maybe you can help the audience understand. Why do we talk about council conclusions and reference a letter to Minister of Finance, but also how to tailor it? And then you will also receive a list of contacts, everyone. So Sophie, over to you.
Yeah, thanks. And super presentations from Katie and Joanna. I think the message, at least for me, but I hear it every day, is really clear. And just to clarify and pick up on some of the comments in the chat, maybe on the council conclusions, to specify it's a tool. It's really a tool. There's no guarantee that this will be implemented. There's no timeline that politicians have to adhere to. And there's no guarantee. So I think what Joanna was saying, that, also make no presumption that someone else will do it. And the best thing that can happen is that a Minister of Finance or a Minister of Health receives 10 emails in these coming weeks about the importance of cardiovascular health. That's a super strong message, because at the end of the day, you sending it at a local level, you are their voting community. So I think that's super, super important, and to grow this political pressure, and also gives the expectation that there is this community that is expecting it, and that they can't, as Kitty was saying, just put it in a drawer, but we really expect some items to be implemented, hopefully. And then on the templates that will be sent, indeed, they are template, just that. So it's very generic, of course, cannot tailor them to accommodate all different EU 27 member states. So really, when you receive this, take a look, and you are the experts in your local region. I was saying before we started the webinar that, when you apply for a job and you're tailoring your CV and your cover letter, you need to do the same thing when you're approaching the Minister of Health. Have a look, what are the current national priorities or crises, and how can we link CVD or cardiovascular health into that? Because no matter the topic or their interest, there's a way. If it's agriculture, there's a way. If it's driving or traffic, there's a way. If you link to the driving license and a screening needed for people to get their license. So, and we're really happy as each to discuss this and talk about different narratives and speaking points. So, yeah, don't hesitate to reach out to myself as Secretariat, or your representative partner if you are affiliated to one, or if not, also welcome to.
Thank you so much, Sophie. And again, I think everyone who is joining this webinar, we will put in the email contact details for Sophie, for Joanna, for Kitty, if she's okay with that, and with FH Europe Foundation. I wanted to, since we had this webinar 2 weeks ago, I was thinking a little bit more about different tangible examples, and obviously I need to bring it back to our community, specifically FH Europe Foundation and lipids, because it's a historic document for us, where for the first time there was actually reference to familial hypercholesterolemia and elevated lipoprotein A. There's also reference to rare diseases and screening, early detection. So how have we used that? And that was already in the on the 24th of March, when we observed the Lp(a) Awareness Day. We had the summit, and as a follow-up of the summit, there was the Brussels International Declaration, which now is open for endorsements. And it only hit me a few days ago when we were preparing for this webinar that this is already a direct implication of the Council conclusions, and implementing it, and then taking the endorsements back to the politicians. And I think what I wanted to emphasize here, and I welcome Sophie and Joanna for comments, we need to be able to distinguish between Council conclusions on the European level, which are a roadmap, and nobody will be held accountable for implementing, because there is no obligation to implement them. And there was a question in the chat about it, versus the European Cardiovascular Health Plan, an umbrella document for the European Union, versus national cardiovascular health plans. And I think it's extremely important that our listeners distinguish that. And I think Council conclusions absolutely could and should be used when influencing the EU politicians, but also you influencing them on a national, local level and saying, you know, we advocate for this and that. But overarching message here again from Joanna's example was the fact that nothing will happen if there is no funding to go with that. And we know that very, very well. That's why we need to go an extra mile and take an extra step to go beyond ministers of health, but also engage ministers of finance to allocate funding for implementation. And I would welcome you, Sophie and Joanna, if you would like to add to that.
Yeah, thanks, Magda. I think it's an important point, and we're throwing a lot, I guess, at the audience as well on the conclusions, the plan, national plans, but all are really important. I think from our side, our biggest concern right now is that, a bit like Kitty mentioned, having the council conclusion, then it goes in a drawer. What we want to avoid again now with the drafting of the EU Cardiovascular Health Plan is the same thing, that they publish some kind of communication and then it goes in a drawer without funding attached that can be transferred to national level to carry out certain actions and recommendations. So this is why the focus of the webinars on both the conclusions and to share the urgency to act on the budget and to ask ministers of finance to earmark this budget in the next EU budget to go towards cardiovascular health. And I think I saw also there's someone in the audience from BAC, the Belgium Alliance for Cardiovascular Health. And I think that this kind of sister alliances to each, let's say, so multi-stakeholder alliances at national level are also hugely important because they also come together in a coordinated way, united voice from different cardiovascular community stakeholders. And this is really powerful as well. And I think Belgium had some success recently through the BAC, Belgium Alliance for Cardiovascular Health. So it's also some food for thought for the future as well for some of our advocates in the audience.
And if I could just jump in on that, just on one side, which is why advocacy is so important in a space like this, because council conclusions and an EU plan isn't law, and they have no, nobody's really holding their feet to the fire unless advocates do it. So having a council conclusion is great. They've kind of put a promise out there, but unless you hold them to your promises, they're not really necessarily going to feel the incentive to do so, which is where the advocacy community really comes into play, because they're going to say, I saw you made this promise. You put out these council conclusions. You said you were going to do this. And now we're asking you, what have you done? When are you going to do it? What money have you put in front of it? And that's, I think, the best way to use the council conclusions, because you are basically holding them to their promises. They said they're going to do something. Now they have to do it. And that's why advocates are so essential in this space.
Absolutely. And Joanna, you've touched on one other important element. You don't have to be a patient advocate to be an advocate. I think advocacy is all of us. And what else I've learned over the past few years collaborating with different institutions in Brussels and in Strasbourg is that if you are if you represent a member state, just like in your own specific country, you would have members of the parliament. You also have the European members of the parliament. And that's why, as each, we always reach out to our community and say, please identify member of the European Parliament from your country, because they're basically your voice and you can hold them accountable for those actions. Mm-hmm. They can put pressure. And I think it's almost, I feel almost excited, Sophie and Joanna, because with this webinar and with this session, it almost feels like we bring together all the efforts from the past several years when we're trying to engage with the community and help navigate and explain practically, in practical terms, to our communities what power you have got in your hands if you know how to practice it. And I think council conclusions give you very tangible, specific points where you can follow up. Now, obviously, for all of us, it is the time to put pressure on both the European and local level, so those promises are supported by actions and funding, so it is sustainable. Mm-hmm. I can see that we are coming to an end of our session. We have last 5 minutes. So with that, I would like to give floor back to our speakers. If there was one thing we could achieve as a community as a result of those webinars, what would it be? And while you answer, I will ask our team behind the scenes to post one last survey, which will help us understand how well you found this session. Has it helped you to understand the council conclusions? And do you feel empowered to send, as an example, a request email to your Minister of Finance to act? So while you guys do that, one last statement from you, Sophie and Joanna.
You never know who's going to talk first. I guess I can just say that if I wanted anyone to walk away from the webinar with anything, it would be that you don't have to be an expert to do this. Of course, it's good to be informed. That's why we're here. We want to do the best we can. Just don't let the fear of not knowing everything or having the perfect access hold you back. There's a whole community here working on the same goals, and you're not alone. And if we work together, we can make a difference. And the last thing is, do remember that on the other side of every email or every letter is just a person. Policymakers are just people, and often the decisions they make come down to the relationships they have, the people that they hear from. So definitely just get out there and use your voice.
Yeah,
Thank you so
I
much,
can only
Joanna.
echo that. Yeah, absolutely agree 100%. So really nicely said. So I just compliment that and agree that hopefully during this hour you feel that, you know, policy advocacy, that it's not such a foreign area and it's really your voice matters, as Joanna said, and that really people want to hear from you. Really, you don't have to have I don't have a degree in policy either. You know, it's really your voice matters, and the more varied and diverse those voices as well, the better. So thanks.
Wonderful. And with that, we have the results of our voting here. It looks like the 100% of those who were responding said that they found this session informative and helpful, which is great. And 24 of you, so 73%, said that you will feel empowered to take an action. 6% not so much, 2 of you. Please let us know what can we do to help you. And 7 of you felt it's not necessarily relevant, but if it's not relevant, hopefully it will inspire other actions as a trigger effect. I would like to take this opportunity, and again, that was not necessarily scripted before, and I hope my fellow speakers won't mind, but alongside those actions that you can take right now, we can also already endorse the LP(a) International Declaration, which is as a result of the council conclusions. We will be taking it back to the politicians. So please do give it a yes. And for our community that's online from stroke, from rare diseases, and anyone else, please let us know how can we collectively support you, or if there are any other examples. We know that EHN published an advocacy document to support patients, and we will be happy to disseminate it. So collectively, there's a lot of examples, and we can really, really push that important mission towards a good outcome. So with that, I wanted to thank Sophie, I wanted to thank Joanna, I wanted to thank Kitty and our team at FH Europe for putting together this webinar. Thank you so much.
Thank you so much. Bye-bye.
Thank you. Bye.